I'm Jen. I'm a physician assistant here at Uterine and Digestive Health Specialist, and I'm here today to talk to you about hemorrhoids. So hemorrhoids are super common. So about 75% of us will be affected by hemorrhoids at some point in our life. Nothing to be embarrassed about. These are just blood vessels in our bottom that can swell, become irritated or inflamed. They're actually a normal part of our anatomy. So everyone has 3 chains of hemorrhoidal columns. If they're above, we call them internal hemorrhoids. If they're below, we call them external. The internal, because of the innervation, they tend not to cause pain, just because that's how they're innervated. The external ones can cause pain. So some typical symptoms of hemorrhoids: itching, bleeding, swelling. You might notice that it's hard to keep clean, like you clean and you're still dirty. So the prolapsing tissue, it kind of interferes with your anal closure and the stool can get stuck there. Prolapsing, the tissue penetrates outside of and you can feel like a bulge, but itch, pain, bleeding, those are some of the most common symptoms. So what causes hemorrhoids? There's not one factor necessarily that causes, people to get hemorrhoids. Sometimes it happens after childbirth, all the way to that baby for 9 months, and then the pushing during childbirth puts a lot of pressure on those vessels. So acutely after childbirth, women will often have, symptoms of hemorrhoids, and it can linger on. Many women will say, my hemorrhoids started after the birth of my, 18-year-old kid. So that's not uncommon. If you have a lot of weight in your belly, pushing down on those blood vessels in the bottom, that can cause the hemorrhoids to flare. So things like excess weight, straining if you spend a lot of time on the toilet, if you have chronic constipation, you have poor bowel habits or chronic diarrhea, you use enemas on a regular basis, you ride a bike even, or you do heavy lifting for your job, or maybe for working out at the gym, you're doing a lot of squats. That puts anything that puts a lot of pressure on those bottom blood vessels can cause symptoms of hemorrhoids. So how do we treat hemorrhoids? Well, first and foremost, we need to rule out other conditions that could present with symptoms that mimic hemorrhoids. So we want to send everybody for colonoscopy and rule out things like colorectal cancer, proctitis, inflammatory bowel disease. So that's first and foremost. Everyone needs their colonoscopy. We need to take a look, see what's going on, rule out other conditions. After that, we may try medical management. So this means, we're gonna, if you can tolerate it, we increase the fiber in your diet. We try to bulk up the stool, help get control of any underlying chronic constipation or diarrhea. We address those issues. We may need to do something called anal rectal manometry, where we try to get to the root cause of what's causing your chronic constipation, which is leading to your persistent hemorrhoids. We may try things like creams, hydrocortisone creams, or other creams to decrease the inflammation, address the pain in those blood vessels. We might use sitz baths, where you sit in like a warm bath of water to get off the fecal debris around the hemorrhoid and kind of calm things down. So we may use some over-the-counter and prescription creams, ointments, some treatments to address things just a little bit more conservatively. After that, we may recommend something called banding, IRC, or HET. So what I'll first talk to you about is the CRH-O'Regan system. This is a non-surgical hemorrhoidal treatment. This is what we commonly call as banding. So as far as banding, what is banding? So this is a fast, painless procedure. There's no bowel prep, no sedation, no downtime. You can literally come into our office over your lunch break and have this done. It takes pretty much a few seconds. So it takes about a minute to perform. What will happen is we will band the area that doesn't have any nerve endings. So these are your internal hemorrhoids that we're putting the rubber band on. And it's just a little teeny rubber band, smaller than like the teeniest little hair tie. And what we're going to do is Dr. Sinha is going to take like a little suction device, and she's going to, so it looks like this. This is the CRH-O'Regan system. This is the depth that it'll be inserted into your bottom. This is actually the actual size, and that right there, that little black thing, that is the band that's used. It's that teeny. So that band's going to go over, it's going to stretch over here. She's going to put this system up to your hemorrhoid, to the problem area, and she's going to basically pull back, create some suction, release the band on the base of this hemorrhoid. and that band will sit on your hemorrhoid for about 2 days. It'll cut off the blood supply to the hemorrhoid. The extra tissue will fall off with a normal bowel movement in about 2 days, and we will get rid of your hemorrhoid for you. So, and you don't have to find the band in the toilet or anything, like you just flush it down, but this will result in the loose tissue scarring back into place, and it eliminates the tissue prolapse and any accompanying symptoms that you might have, the itch, the burn, the pain, the bleeding. They should resolve after this. So what we do, because like I talked about before, we all have 3 chains of hemorrhoids, right? These vessels, there's 3 hemorrhoidal columns. We have to treat each chain. So we'll do these treatments separately, staggered 2 weeks apart. So you'll come in during your lunch break, she'll treat the one hemorrhoid, she'll put that little device up to the hemorrhoid, put the band on. 2 days later, that band will fall off in the toilet. And then about 2 weeks later, you'll come back, she'll treat the next chain of hemorrhoids. 2 weeks after that, she'll treat the next chain of hemorrhoids. And after that, for most people, that's all they need. And that kind of does the trick. So another option is infrared coagulation, or IRC. So some insurance companies will, cover banding versus IRC. Some patients, they want 1 treatment versus 3 treatments. IRC is nice because it only requires 1 treatment typically. It looks a little bit more overwhelming, whereas with banding, you have a nice little suction device. It looks real benign. With IRC, we use this machine. It's big and it kind of looks a little bit scary, but it produces nice results. So what happens is Dr. Sinha will come into the room, you'll be lying on the table. Again, this can be done like during your lunch hour. She'll put up the infrared coagulation device to right above the hemorrhoid, and she's gonna use heat to basically cut off the blood flow to that extra tissue. The extra tissue will scar off, and after about 7 or 10 days, kind of fall off with a normal bowel movement. You won't notice anything, but for most people, that will be enough for your hemorrhoidal symptoms to resolve. All right, so a third option is HET, or hemorrhoid energy therapy. So this is an option that is, we use a low temperature radiofrequency energy, and what we're going to do is during your colonoscopy, this therapy will be applied to your hemorrhoids. So for some patients, after they have this therapy, it works very well, but they can have some more side effects from this procedure. They'll have more bleeding. We're creating scarring around that extra tissue and causing the hemorrhoid to shrink and scar up so that it doesn't cause you any symptoms long term. So HET, unlike the other 2 options, the banding and the IRC, which are done in our office and can be done like over your lunch break, HET is only done under anesthesia during your colonoscopy at our surgery center. So hemorrhoids are quite common. 75% of us at one point in our life are going to be affected by hemorrhoids. They're nothing to be scared about or embarrassed about. We see these all the time, all day long. 10, 20 patients a day are coming in with hemorrhoidal symptoms. So it's nothing to be ashamed of, nothing to be embarrassed of. We've heard it all. But there are many treatments that are very effective, and it just depends on what treatment you want to do. We'll figure out what's right for you, but you don't have to suffer. There are options available for you that work very, very well. So please come in, see us. Don't be scared, don't be shy, and we will help you get control of those symptoms so you can be more comfortable and live a pain-free life.